Welcome back to the channel. Today we're talking about a very common women's health issue that many people feel shy to bring up, and that's leukorrhea, or excessive vaginal discharge. Some discharge is completely normal and actually healthy, but when it becomes too much, uncomfortable, or noticeably different, it can be a sign that something else is going on. So let's break it down in a simple and straightforward way and talk about what causes leukorrhea and how you can manage it safely. First, let's understand what leukorrhea is. Vaginal discharge is your body's natural way of cleaning and protecting the reproductive tract. Normal discharge is usually clear or milky, doesn't have a strong smell, and can change throughout your menstrual cycle. Leukorrhea happens when the discharge becomes excessive, thicker, starts to smell unpleasant, or comes with itching, irritation, or discomfort. These changes usually mean the natural balance of bacteria or hormones in the vagina has been disrupted. One of the most common reasons for leukorrhea is normal hormonal changes. This can happen during ovulation, pregnancy, puberty, or even with sexual arousal. In these situations, the discharge may increase but is usually harmless and doesn't require treatment, just reassurance and good hygiene. Another major cause is infection. Yeast infections or candida typically cause thick, white, cottage cheese-like discharge along with intense itching. Bacterial vaginosis can cause thin, gray discharge with a fishy smell. Sexually transmitted infections like trichomoniasis may cause yellow-green, frothy discharge that can be irritating or painful. These infections need proper medical treatment, so if you notice any unusual color, strong odor, or discomfort, it's important to get checked by a healthcare provider for the right diagnosis and medication. Poor hygiene practices can also lead to leukorrhea. Using harsh soaps, scented sprays, tight synthetic underwear, or sitting in sweaty clothes for too long can disturb the vagina's natural balance. Stress, poor nutrition, anemia, and chronic illnesses can weaken the immune system, making infections more likely. Now let's look at how to manage leukorrhea. If the discharge is due to normal hormonal changes, simple steps are usually enough. Keep the genital area clean and dry, use mild unscented soap only on the outside, and avoid douching because it removes healthy bacteria. Stick to cotton underwear and avoid tight clothing that traps moisture. Drinking plenty of water and eating a balanced diet also supports your body's natural defenses. If an infection is the cause, getting the right diagnosis is essential. Yeast infections are treated with antifungal medications, either oral or topical. Bacterial vaginosis is treated with antibiotics like metronidazole or clindamycin. Sexually transmitted infections require targeted treatment, and sexual partners usually need treatment too to avoid reinfection. Avoid self-medicating, especially if you're pregnant. Home care measures can help with comfort and healing. Warm water rinses can soothe irritation, and avoiding scented products helps prevent further imbalance. Good menstrual hygiene, like changing pads regularly, is important. Probiotics, found in yogurt or supplements recommended by your doctor, can help restore the natural vaginal flora. If discharge keeps coming back, doesn't improve, or is linked with pelvic pain, fever, or bleeding, you should get checked right away because these symptoms can signal something more serious. Remember, vaginal health is an important part of overall health. Regular checkups, practicing safe sex, living a healthy lifestyle, and paying attention to your body's signals can prevent bigger problems. Leukorrhea is common, manageable, and often easily treatable once the cause is identified. The important thing is not to ignore changes and to get proper guidance when needed.